Okay, great, folks. We are going to start on time today. My name is Maggie Maurer, and I am an academic and industry relations manager, kind of short for academic recruiter. And I'm really excited to have all of you here this Saturday morning. We have Dr. Jessie Deffendall here, and she has been with Aspen. What do you say, Dr. D, like 3.5 years, right?
Mm-hmm.
3 years? Yeah. So thank you very much for joining us, Doctor. Really excited to have you here because I know you just have a really great Aspen story, and I'm hoping you can share that with everybody. Again, everybody that's logged in this morning, I really appreciate it. I know it's kind of early for some of you, so thank you. You know, you might be in your pajamas, but hey, I think it's great. I had to get up and get dressed this morning. So, well, let's get right to it. Why don't you tell us about yourself? Doctor, you want to just start off with that?
Sure. I am from Nashville, and I went to the University of Louisville for dental school. I graduated in 2017, and I started with Aspen right after I graduated. I rotated as an associate through 3 different offices in Louisville, Kentucky. And then after about 1.5 years, I was ready to be on my own. And so Aspen asked me to go to a more rural area of Kentucky to help with my student loan repayment. And so I'm in a 2-year commitment in a rural area of Eastern Kentucky now.
Oh, nice. So that was a good decision for you to make for your own situation. That's great.
Yes.
Yeah, nice. Well, we have a couple questions coming in. What was your process in determining that Aspen Dental was the right move for you over maybe private practice or another DSO?
Right. I shadowed at a few private practices and some other corporate DSOs, but I really I felt like private practice was a little bit slower. I didn't feel like they saw as many patients per day. I felt like there was a lot of sitting around. I just wanted something that was pretty upbeat, where I'd be busy. And at first where I'd have a lot of hands-on doing production and getting more practice, because I felt like I didn't do quite as much as I wanted to do in dental school. So I wanted more practice, and I wanted a mentor who would teach me and give me feedback so I could really become, the type of clinician that I wanted to be.
Oh, nice. Great. And so part of that, your first 1.5 years rotating between those offices, you were receiving mentorship, right? So from three different doctors, or how did that work for you, just rotating between offices?
So with Aspen, the first 4 weeks of any new dentist is what we call DDP, which is Doctor Development Program. And so I did my 4-week training with the owner of all of those practices. His name is Dr. Enan. And so I rotated around the practices with him and mostly assisted him and kind of learned about the flow of the offices and, the different dentures and just kind of the differences that are more Aspen specific. And then throughout that 1.5 years, there was a lead dentist in each of those offices. So I liked going to each of the offices because they each had a different way of doing things. And sometimes I liked what one practitioner would do, and then I felt like I learned something different with a different practitioner in a different office. So it kind of gave me a wider range of mentors, I would say, that had a different variety of skills, and I learned a lot of different things from each one of them.
Oh, that's good. So I can actually skip over this next question. How have you grown since joining Aspen Dental? But, I think this question really is a great lead into this subject is what were you uncomfortable with right out of dental school, and what did you feel like you progressed the most with just in your first year?
Sorry.
It's okay.
I was probably the most uncomfortable with surgery. I really had done a few simple extractions in dental school, only one surgical extraction. I'd never really done alveo. I had a little experience with implants, but I really wanted to get a lot better at surgery. And so I really focused. Aspen is a lot of patients who haven't been to the dentist in 5, 10, sometimes 20, out here 30 years. And so they need a lot of work. And sometimes the best thing for them is just extractions and dentures. And so I wanted to get a lot more comfortable with that because I really felt really scared, really uncomfortable taking out teeth. And so that's probably what I spent the first year, most of getting a lot better at. Obviously restorative and crown and bridge and all those things as well, but I wanted to get a lot better at surgery. So probably surgery, and then also treatment planning. In dental school, you have like a few 3-hour appointments and you sit down with your professor and you have mounted models, and there's a lot more time and feedback to treatment planning. And when you go in to see a new patient at Aspen, you have about 10, 20, maybe 30 minutes with them to come up with a treatment plan, present it to them in a clear manner, and have them accept it and start treatment. And so that takes a long time to get in a good rhythm of being good at that. So probably surgery and treatment planning.
Oh, that's great. So do you, this question just came in, will I do my own treatment planning?
That's a great question.
Yeah.
Usually the lead dentist in a practice is the one who is doing the treatment planning. So I would spend a lot of time with them, kind of getting on the same page about what I was comfortable doing versus what I wasn't comfortable doing. And there are always, situations that come up where maybe somebody thinks it's a filling and somebody thinks it's a crown, or somebody, there are differences in professional opinion, and that's fine as long as they're reasonable. But I did feel comfortable going to those dentists and saying, hey, I don't really see decay in this tooth, or hey, this filling was a lot bigger than it looked on the x-ray. I really think it needs a crown. I think as long as you communicate with the patient and the people that you work with, then I never felt pressured to do something that I wasn't comfortable doing, even if it's something I didn't treatment plan.
Okay, nice. And this question, as an associate, you come in as an associate dentist, and what cases do associates see?
So I just had a brand new grad come into my office and be my associate about a year ago. And so I just started him with fillings. Really, he started doing a little crown and bridge, simple extractions. I let him assist me to begin with to kind of show him how something should be done. And then eventually we kind of traded places and I would assist him and help him if he was struggling something, or check his crown preps and make sure everything looked good. And so it was kind of a slow transition. And probably after about 6 months, he was doing all the full mouth extractions and sedation cases. But it's a very, and every person is different. Every practitioner is different. Some people might come in ready to take out full mouth of teeth, and some people might take years to get to that level. And so it just, he was ready to, he just slowly, got better and faster and more confident in what he was willing to do.
So I'm just going to add this, for those of you that don't know, Aspen Dental we have over 840 offices across the country, and we're the largest branded DSO. So almost all of our offices are owned by a dentist. And then Aspen Dental Management Incorporated comes in and handles the business side of things for that practice. So have you considered becoming an owner at some point?
I would love to become an owner. That would be a privilege for sure. My owner owns 12 offices, and so he partners groups of locations together. And so I would love to partner one location or multiple locations with him, or potentially move to another place and own.
So do you feel comfortable in, taking on that process? Do you feel like Aspen Dental would, walk you through that process?
Yeah, I feel like at every transition, Aspen is really transparent about what we need to do to take the next step, and make sure, even from going from an associate to being an MCD to being, the lead dentist in an office, that's a pretty big transition. So I definitely trust Aspen, and I trust, the ADMI side of things. And I think that they come in and help with efficiency and help with communication and do all those things that let me focus more on the dentistry than on the other things that are not necessarily clinical.
Good. We have a question from a 2021 grad, and they would like to know what point in dental school did you decide to start to talk to DSOs and private practices about your career?
I think that even when I was a pre-dental student, I shadowed some private practices, my family dentist. And so I wanted to just have an idea of kind of what was out there. I think people probably still don't go into dental school thinking that they're going to work in a corporate, entity. But after all the student loan debt has accumulated and, looking at what the opportunities are out there, I think that I started to interview with Aspen maybe the fall of my senior year. Aspen's good about doing events and coming to tailgates or football games or sponsoring events. And so they always have someone there who's easy to talk to and transparent about what Aspen has to offer. And so I think I started the fall of my senior year, and I think I accepted an offer maybe February of my D4 year.
Okay, great. So let's talk about the student repayment loan process. For those that don't know, Aspen Dental does, help with student loan repayment for those that will go into areas that are just sometimes remote, tougher cities to fill our positions. And it was an incentive for you, right? So how did you make that decision? Did you always have your eye on that prize, or was it a little bit scary for you to go to work in a city that maybe wasn't close to home? Or
it was a really big step. I loved where I live. I love where I live in Louisville. It's a good city. It's a good size, and I never saw myself really leaving there, especially for work. But the burden of student loans is pretty significant, and to think about paying, thousands of dollars over 10 to 25 years is a pretty big burden. And so when I didn't feel like I was able to run an Aspen by myself when I first came out of school. And so I wanted to feel very confident in being able to be by myself first, which is why I really liked being an associate for about a year and a half. And then it was a pretty big leap of faith to come out to Eastern Kentucky. I'm probably 2.5 hours from a major city. And I'm also 2 hours away from any other corporate dentistry. There's no other DSOs in a 2-mile radius around me. So it's a wonderful opportunity for dentistry. It's a really underserved patient population. And so it was a 2-year commitment to come out here and run the practice. And it was the best decision, apart from joining Aspen. This is the best decision that I ever made. I feel much more confident in my clinical skills, my leadership skills. It's something that everyone should consider if they feel burdened by their student loans.
Yeah. Oh, that's great. So 2 years goes by so fast, doesn't it?
Yeah. It has flown by.
Right. It's crazy because you're looking at it like, I don't know, that's a long time, and then it's gone, right?
Yeah, it flies by.
Yeah. And tell us about the population that you serve. You must, because I have a question here, what are you enjoying about dentistry? So, touch on, what you do enjoy, and I'm sure your patient care is going to come into this conversation.
Yeah. One of my favorite appointments is denture delivery, which seems like kind of the nerdiest thing, but a lot of these patients here don't have any natural teeth, and they don't have dentures, or they're in dentures that don't fit and they've broken and they've glued them back together and they can't eat. And so a really rewarding day is really denture delivery, because a lot of the patients cry as, they're
I would
walking out the
cry.
office. And
Yeah.
they're hugging the staff, and
Yeah.
they've gone to other places, and whether they felt judged or they felt like there was no on-site lab, and so the process took a lot longer, and they didn't do a wax try, and so the dentures aren't how they wanted them to look. It's really rewarding to to give people a smile back.
Yeah, that's wonderful. So we can talk about, the denture lab that exists in each one of our offices. So can you, talk about that process for a patient?
Yeah, so just like dental school, we do dentures the exact same way here at Aspen. So it's a 4-step process. The first step is impressions, and these are for replacement dentures, so patients who don't have any teeth.
Mm-hmm.
But we take impressions, and then we do a wax bite, and then we do a wax try-in, and then we do delivery day. And we have an on-site lab in every Aspen, which really sets us apart for removable. My lab tech is amazing. She makes the most beautiful setups and teeth I've ever seen. Every denture or delivery is like a dream, no adjustments. She can do anything, really.
Wow.
And the patients function so well. They almost never come back for adjustments. It's really smooth process, and there are limitations of maybe what I remember from dental school and maybe what I don't remember from dental school about partials. And she helps me. She holds my hand anytime she can come chairside and talk to the patients about, hey, that's not something that we can do, or hey, we can order bigger teeth. It's an incredible thing to have a removable lab tech in your office.
Yeah. Yeah, that's great. Nice. Here's a good question about salary. What is the average salary for a new dentist in their first year? I can help you with this if you.
Yeah.
Yeah. So a lot of the salaries, all of the salaries are really negotiated with your practice owner. So it can vary, for each new associate. Typically, it's in that 500 to 550 guaranteed daily rate. So going off of that, Doctor, can you explain to our audience just about that guaranteed daily rate and then the profit sharing that everybody, has the ability to earn?
Sure. So that's one thing that I really liked about Aspen, is that it's not percent collections, it's not percent production. It's a guaranteed daily rate that it's always going to be there. And so that you can make all your house payments and your student loan payments, and you're never going to worry about, whether your collections aren't very good that month, because your front desk isn't taking in money, or, or you're not pressured to produce because, you're getting paid off or there's no competition between the dentists because it's not based on individual production. And so that's what I really liked about Aspen as well when I was looking at different offers. But Aspen also has a profit share system where we take a lot of things into consideration, like production and collections. And also I can order whatever I want, but that's part of the, there's no, you can't order this, you can't order that. I can order whatever I want. But that's taken into consideration as well in this profit sharing. Another part of the profit share is how happy the patients are. So they get a patient satisfaction survey after their new patient appointment, asking them if they waited a long time in the waiting room, or if they felt confident in the treatment that the dentist provided for them, if they feel, if the payment options were explained clearly to them by the office manager. And so that is a factor that motivates the staff to have happy patients and provide good care for patients, because it does affect your income.
Yeah, it's really just a great business model.
Yeah, I love it. I think it takes everything that matters into consideration.
Right, right. Does Aspen Dental give a fixed 1 or 2 year salary contract? This is a question that just came in.
So, and you probably can answer this better than me, but Aspen Dental doesn't do contracts.
Right.
They just want their dentists to work if they want to work, and if they're not happy, they're free to leave.
Right.
And there's no non-compete, so you could open up shop next door if you want to. So there are no contracts, which I think is the best thing. You know, you're not locked into somewhere you don't want to be, and if it's not working out, then you can leave, and it's working out, then everybody can stay. So
Right. Yeah. So those of you that are listening, we have an agreement, and I think Doctor can highlight this too. They're not 13 pages long. It's 2 or 3 pages.
yeah.
And like Doctor said, it's not a contract. You're free to leave if you're not happy. So I have a question here about so what part of the country, if you were to choose, what part of the country would you like to be practicing in if it's not your hometown?
I've never really thought about that question. Maybe Colorado is kind of a place that I've thought about practicing. But it's good to be a dentist in Kentucky.
Yeah.
So I'm pretty happy here just for now.
Okay, good. Do you have anybody from dental school that you went to dental school with that joined Aspen as well?
Yes, I do. I have a few friends from my class. One's in Nashville, one's in Miami. One is in Elizabethtown, Kentucky. I have a few friends from dental school, none that stayed really in Kentucky, but more that signed with Aspen while we were in dental school, but went to other states.
Okay, right. Nice. So you probably keep in touch with them. Is there, the culture of Aspen? Can you kind of speak to that as far as, whether you went to school with somebody or just people in your network within Aspen family?
Right. So Aspen throws really fun events, usually when we're not in a pandemic. And so at least once a year, usually twice or 3 times a year, we all get together and we do CE and we really network so that it does feel more like a family and like a culture, and we're all in it together. And so usually I see my classmates at these events, and it's kind of fun to relive the days of being in dental school, but also talk about things that we're having trouble with in the office, or if things that are going well, and it is kind of a resource to share professionally, things that are working well or things we could do better.
Yeah. So let's kind of touch on the pandemic, because I have a question here. Do you feel supported as far as PPE and what's available to you?
So I've never been so glad to work for a large corporate organization as I have felt during the pandemic. So right when really states started shutting down, and everywhere was a little bit different based on state, but the Kentucky board said no elective medical. So Aspen shut down, very quickly after that, obeyed all the federal and mostly state regulations. We were open for emergency care for a little while, and then we just decided to close so that our employees could file unemployment. And then when things were allowed to reopen, we reopened very quickly after that. Aspen's supply chain was amazing. We had gowns and masks and, cabbie wipe and spray. We never ran out. It just automatically shipped from Henry Schein every week. We didn't even have to order it. It just showed up at the door. We have almost more PPE than can fit in our sterilization room. So I've always felt like we were, we got rid of the waiting room. So patients wait in the cars, and everybody gets question screened and temperature screened when they come in the door. And all of the operatories are closed. They're private. So there's no, really interaction between the patients. And so I've always felt really safe since coming back.
Good. And that leads into, our Smile Wide, Smile Safe program that we have in place, which, we're doing those deep cleanings of the office in between patients. Like you said, the symptom screening and the social distancing. People are waiting in their cars, right, before their actual appointment time. So, And virtual visits, did you participate in any virtual visits?
So I was trained, but I think they were having trouble getting a good system down in some states. And so Kentucky never went live for virtual visits,
Okay.
but we had planned on it. But I think
Okay.
that things came back on board more quickly than they anticipated in person.
Mm-hmm. So with your office closed, how long of a duration was that period of time?
I think it was about 6 weeks.
Okay. And then getting ramped up to open the doors again, did you feel that there, like floodgates opened, like there were a lot of patients that needed to be seen? How did that kind of play out?
So we opened, even after elective medical care was reopened in Kentucky, we really opened just for emergency care. And so we only had a maximum at first of 3 patients in the building. And so we remained primarily focused on getting patients dentures who didn't have any teeth, or getting teeth out that were symptomatic.
Mm-hmm.
It wasn't hygiene, and it wasn't routine, elective dentistry. It was mainly emergent care for probably 3 or 4 weeks.
Okay.
And so slowly we had, 4 patients in the building, and then, allowing 5 patients in the building. And so it wasn't ever the floodgates opened and we were back to things as normal,
Mm-hmm.
because we're really not back to things as normal even now.
Right.
But it was done in the right way, I felt like.
Good. So, what resources and training programs do you have available to you?
So Aspen has a ton of CE, always online available. I think right now we just rolled out a new implant course, and it's like 50 hours of implant training that, starts with single tooth restoration, and then overdentures, and then, goes up all the way to all on 4 cases. And so that's really exciting. Aspen during the pandemic opened a ton of free CE to all providers, even with not within Aspen, just general practitioners, because everybody's sitting around not doing anything.
Right.
And then there's always, there's like, there's CE in Chicago, there's hands-on implant training there. There's honestly more than I can even keep up with.
Right. Were you able to take advantage of those CE courses during the office being shut down?
Yes, my boss asked me to do some of the implant training, so I did as much as I felt like I could.
Yeah. So let's talk about implants. Like, how often are you performing implant cases?
So I'm not placing any implants. My owner comes in about once a month to this office, and he places the implants. And then I do everything else afterwards. So I uncover them, single implant crowns. We have a 3D iTero scanner. So after we uncover them, we just put this little scan body down in the implant and we scan it. And then a beautiful abutment and crown come back from the lab, which is really cool.
Yeah.
And then here in this practice, we do a lot of overdentures. And so it's a lot of putting on abutments and then impressing and going through all the steps of a normal denture, and then, kind of the fine tuning of overdentures. But we do a lot of it. We probably have, 10 implant cases right now that we're restoring. So it's a fun amount of implant cases.
Yeah. So I have a great question that just came in. And what does a new dentist find frustrating?
I don't know if I was frustrated as much as I was just kind of scared. I just felt like, in dental school, you do like 12 crowns, and then you don't practice for a little while you're getting your license and focusing on boards. And then you come back and now you are expected to be, a dentist.
Right.
And so I don't know how frustrated I was with anyone other than the things that I didn't do enough in dental school. Probably just wishing that I had had more experience in dental school.
Yeah, I do hear that a lot. And that's really, I know it drew you to Aspen, but I know and many other doctors that, you know, the mentorship program and being able to build your confidence definitely happens at Aspen Dental, which is really important. Um, does Aspen hire part-time dentists or 4 days a week?
It probably depends on the owner.
Mm-hmm.
I think that the reason that we push more for full-time is because we want consistent care for the patients, because just like everybody wants to see the same faces when they come in. And if there's a bunch of different faces every time, then the patient will feel like there's a lot of turnover in the office. And so we just want to provide consistency for the patients. And so I think it's more common to be a full-time dentist, to work 5 days a week. I know that some owners do more of a 4-day-a-week thing, but I think it's pretty rare to be part-time.
This is a really good question. So well, wait, I'm going to move over to a different question. So just based on, you know, your happiness with Aspen, do you see yourself being at Aspen for your entire career?
At this point, I do. I feel like Aspen enables you to figure out the kind of provider that you want to be, and it gives you all the resources to be that provider. There's nothing that I feel like I'm missing. I feel like I'm rewarded financially for working hard, and I feel like it's a positive work environment. It's a good culture. So I don't feel like there's anything missing.
Good. Well, that's good to hear. Yeah. So how many dentists are in your practice currently?
So there's 2 full-time, myself and then my associate. And then my owner comes in about once a month, maybe once every 2 months to place implants. And so he comes in sometimes. But a lot of offices that are in larger cities have specialty. They have oral surgery specialty and they have endo specialty. And so usually we have a specialty day in those offices, or like half a day, and they'll have those come in so that we don't have to refer out.
Right. So that is actually the next question that just came up. You know, do you have specialists that support your office?
When I was in Louisville, I had an oral surgeon, and I would send him panos all the time asking him, like, how did he want them coded, or how long did he need IV sedation for, or even like pathologies that I wasn't really sure about. And he would always help me and teach me. And I felt like that was a huge part of learning as well, because there's a lot in dentistry, even after a path, that you're not really sure about. And so that's having a specialist, even to refer more complex extraction cases, or patients who are sick. There's sometimes that a general dentist just doesn't need to treat a really sick patient, or if they're taking IV bisphosphonates. There are a lot of situations that are more complex, and it's good to partner with someone to provide care for those patients.
Yeah, good. So this is a good question. So do you find that you have enough time off to enjoy the things outside of work?
That is a good question. At this point, I'm really focused on work, and so I really enjoy work. I do work a lot, but I don't work Saturdays and I don't work Sundays, and Friday is a half day, so that's a lot of time off to enjoy whatever I want to do, or if I want to travel. We have paid days off. We have, I think, 6 paid holidays and 10 paid vacation days. So it's not like you're not paid for time off like other DSOs. And so I feel like there's a good work-life balance.
Good. So did you consider, when looking at opportunities for your career, did you take into consideration things like benefits and time off?
Absolutely. A lot of my, I almost said teammates, but I guess dental school classmates, they don't have any paid time off in their practice, so they're only paid for the days that they work, and they're not paid holidays. And so those were definitely, Aspen does contribute 401k. They pay malpractice, health insurance. There's a whole package of, benefits that Aspen comes with that was a big deciding factor for me.
Yeah, good, good. And so as far as insurances that Aspen Dental takes, can you speak to that a little bit?
Sure. Aspen accepts all insurances that are not state funded. So we don't accept Medicaid, we don't accept Medicare. We do accept some Medicare supplement plans, but usually the patients are paying into those. But it's really easy to say that. And it makes it easier on the patients because they don't have to be concerned if we do take their insurance or not. And even for patients that we're not in network with, we offer some third-party financing options that are not available at other private practices or other DSOs. And they can apply for those right in the office at their first exam. And so that really sets Aspen apart, because a lot of time, if you haven't been to the dentist in 10 or 15 years, a treatment plan can be pretty expensive. And so allowing them to pay it over time on a monthly payment plan helps a lot more patients get care than they could just pay for out of pocket.
Right, right. So that's really an important factor so that they can get that care. I personally have been an Aspen patient for 10 years, and in that time I've worked for different companies, and it was just always nice to go back to my Aspen practice, and I just always knew that they were going to take my insurance, So just from employer to employer, I always had my Aspen Dental dentist in place, and never had to switch offices due to insurance changes. So, it does make life much better for the patient. So
Sure.
when we talk about third-party financing, can you talk about that process? Who handles that in the office as far as administratively? What does the administrative functions of the office look like?
So every new patient that comes into Aspen, when they come in, they get a panoramic x-ray, they get a full mouth series. If they have teeth, they get a perio chart with a hygienist, and the hygienist goes over treatment with them. So whether it's prophy or gingivitis or, SRP, she goes over that with them. And then I go in and we come up with the overall treatment plan. And then after we've gone over the treatment plan, I hand all the treatment to my office manager or my treatment planning coordinator, and she puts all of it in the computer, and then she brings the patient into an office, and they go over the cost of treatment. And then, if the patient has saved for this, or they have an HSA, or, if they can pay for it out of pocket, then that's great. And if they need to apply for financing, then at that time, the office manager applies for financing with them. And we have two different options. So if they get declined for the first one, then they can apply for something that's specific to Aspen for the second one. And so, and then if they get declined for those, then they can kind of help them talk about, options with their bank or getting someone else to come apply with them as a co-signer. And so that, that helps the patients out.
Yeah, great. There's a couple questions here I just want to talk about. Being a new dentist, I'll have to rephrase it a little bit. Do you have your choice of what days you work? So I guess, if there is an office, say that is open on Saturdays, as a new dentist, you get to choose what days you're actually working.
And it's going to vary from owner to owner. And so you'd probably have to talk to your owner about that. I do we try and open the office one Saturday a month. And so usually the week leading up to it, I'll let my associate choose what day he wants off. And so that he can have a day off, whether he wants it Wednesday to break it up, or, Monday. So he has a 3-day weekend or a 2-day weekend. But it really probably depends on the office.
Okay, good. So someone is looking at our website while we're on this call and wants to know about the training you had in Invisalign.
Oh, Invisalign is awesome. It's really brought a whole new aspect of treatment planning to the practice. Instead of just veneers and crowns, now we can straighten with ortho. And so the training for Invisalign was like a 4-day weekend. I went to Atlanta, but it's in a hotel, and we bring all the dentists, the hygienists, the lead assistants, the office manager to the hotel, and we had an amazing presenter, Dr. Galler, who was in charge of Invisalign through Aspen, and so we go over a lot. It's kind of a crash course in ortho over the weekend, but it was really fun.
Yeah.
And then when we get back to the practice, we still have a lot of tools at our disposal because we're not orthodontists, the limitations of Aspen and Invisalign are very clear. There's no skeletal class 3s, there's no bilateral posterior crossbites. There are specific things that Aspen does not treat with Invisalign, which I think is really important. And I have a local orthodontist that I refer to here. But moving the teeth and fixing occlusion is such a huge part of how we can help with perio and help create a healthy mouth, that it really seems like something that needs to be in each practice and needs to be, really in the treatment planning. So I love it. And we have a ton of patients who, especially older patients, like 40 and older, seem to be a big patient population who accept Invisalign, and it really changes their whole life. I mean, it's fun to watch them. That's another fun appointment, is the last day of Invisalign, and they're just a new person.
Yeah, that's great. So what would you say the average duration of an Invisalign treatment is? This question's coming from me.
I'd say the shortest case we had was probably six months, maybe. The longest case I've seen is 24 months, but it was pretty significant crowding. And even at the first appointment, when we scan them with the iTero, we can give them kind of an estimate of how long it's going to take for Invisalign. But the price point for Aspen for Invisalign is incredible. It was about $4,000. The past couple of months, it's actually been only $2,500, which makes it, it's $100 a month if they finance it. And so that, is huge for patients, to allow them to get that kind of care.
So do you feel that you have appropriate tools to do your job? Can you talk about, like the iTero scanner and other things that are in your office to help you, perform patient care?
Yeah, so I think it's really huge that every patient gets a panoramic x-ray. Every patient gets a full mouth series. That's not everywhere for sure. Every patient gets a full mouth scan with the iTero. And so we pull it up on the computer for them and show them what's in their mouth. And a lot of times we call it a dental health scan, but it's an educational tool. And if you can see calculus on your teeth on the TV, then it's easier for you to understand why you need perio treatment. Or if you see crowding, it's more easy to understand that you need Invisalign, not just for cosmetic reasons, but really for functional and health reasons. And so there's, even having the iTero to scan implant bodies for single implant crowns, and now we're scanning for partials. We scan for immediate dentures. So the iTero is a huge tool that we can use not just for Invisalign, but for education and for removable.
Yeah, just being an Aspen patient, it's really an incredible technology.
It's really cool, yeah.
Yeah, you almost don't even want to look at it. It's like, those are my teeth. So this is a question about the lab in your office. Is the lab functioning every day that you're open?
Yeah, the lab is open. All hours that our clinic is open. And my lab tech is there all the time. So anytime I'm doing a try-in, she can come in chairside, or I never look at impressions. She either approves or makes them retake impressions for full dentures, for partials. yeah, she's open. She's open all the time.
Okay. And is she the only one? Does she have support?
She is the only one. We would love to have another tech in there, but it's hard to get.
Mm-hmm.
It's hard to get another well-trained lab tech in this area.
Sure, sure. So Aspen Dental offices are sometimes a part of a shopping plaza, or sometimes they're freestanding. They're typically, our real estate team makes sure that they're in an area that's going to be, well served, and we can give the patients in that area care. So tell me a little bit about your practice, how long it's been there, and is it a freestanding office? Is it close to other things in the area?
It's been here, I think, about 4 years, 4.5 years. So it's beautiful. I mean, it feels brand new on the inside. It is freestanding. It's in a major shopping center. We have a Walmart super center, probably a quarter of a mile away. We have like the major grocery store here right across the street. Applebee's, Steak and Shake. It's in a major shopping center, and there's a lot of I don't know if I'd call it foot traffic, but car traffic.
Sure.
It's really accessible, and everybody knows where it is.
Right, right. So you talked about referring patients out to possibly an orthodontist or a specialist that's in the area. How did you build those relationships?
There's really only one orthodontist in town, and so some of my staff who work here worked previously there, and they had he comes highly recommended from them, and so we also have an oral surgeon in town who has privileges up at our major hospital, and so anytime a patient needs to be inpatient, I refer to him, and he's called me a couple times just to talk about patients, which I really like because it provides continuity of care for the patient. And it makes it more of like, a team effort here rather than kind of a corporate versus private practice, which I think a lot of private practitioners are scared that Aspen comes in with 12 dentists and 30 specialists and is going to, suck all the patients away from them. But really it's, for a long time, it was just me. Just one dentist or two dentists. And so we really want to help provide good care for the patients in this area, not take away from any of the practice owners.
Mm-hmm. Yeah, that's great. So, just being the new kid on the block, we're not threatening, right? Yeah, that's great. I'm going to wrap things up here. Do you, on any given day, is it difficult for you to, enjoy your job? Or would you say that you're pretty happy every day?
I'm pretty happy every day.
Good.
There are always days that are going to be tough.
Mm-hmm.
And there's going to be patients who are not very grateful, but there are always going to be patients who are really grateful and who tell you that you've made a difference in their life. And I like that Aspen is very like task oriented, like, this is the next thing we need to do, and then the next thing we need to do. And so it makes the day go by pretty quickly when you're busy. And I really love my job. I mean, it's easy to talk about it, and it's a fun place. I don't dread getting up and going to work in the morning, and, the day goes by quickly, and, it's kind of about your attitude, no matter what you're doing. Is that if you're positive and your coworkers are positive, and like we'll cook dinner for each other about one Thursday night a month, and we had a cornhole tournament this week during lunch. So it's kind of about being a leader and making the practice whatever you want it to be.
Oh, that's great. That sounds like a great group there. Yeah. Everywhere I go, it's always pretty happy in every Aspen Dental office. It's just the teamwork and the family atmosphere is wonderful.
For sure.
Yeah. So is there anything you want to add before we say goodbye to everyone?
No, I mean, thanks for having me. And if anybody has any questions, or can feel free to reach out. I'm an open book. And
those of you that are listening in, I can share Dr. Jessie's email with you. If you do have specific questions, and myself, we're always available. So I really thank you. for being with us today. And those of you that have sent in all your questions, we really appreciate it. And if there's anything that comes to mind that you want to ask us in the future, definitely reach out. And I wish you all a very happy weekend. Bye, everybody.
Bye.
Bye.